Hi, my name is Haley Matney, and for my nursing theory, I did the Child Health Assessment Interaction Theory by Catherine E. Barnard. A little bit about Catherine Barnard. So she was born on April 16th, 1938 in Omaha, Nebraska, and from a very young age, Catherine knew that she wanted to be a nurse. And so she ended up getting her BS in nursing from the University of Nebraska in 1960. Then, couple years later, she got her MS in nursing from Boston University in 1962. And then, about 10 years later, she got her PhD in ecology of early childhood development from University of Washington in 1972. So, Catherine was a professor of nursing at the University of Washington from 1972 to 2006. She was also an adjunct professor of psychology at the University of Washington. And while her time at the University of Washington, she ended up becoming the founder of the Barnard Center for Infant Mental Health and Development at the University of Washington. And so she also served on the National Center for Clinical Infant Programs, which is called 0 to 3, for 37 years. And this is a national nonprofit that provides parents, professionals, the knowledge and how-to nurture early development. And so she served on the board for about 37 years. And then she also, the research that she did conduct about early child development and the interaction between parents and children and how important it is for development, that research provided the foundation for the Nursing Child Assessment Satellite Training. And this is a program that teaches professionals, parents, and caregivers the skills to provide nurturing environments for young children. So the theory that Catherine Barnard came up with was, so according to Barnard, the child health assessment interaction theory is the theory that healthy child development is dependent upon the caregiver or the parent responding to the signals from the child in a loving and demandable manner starting from the moment of birth. And what she ended up discovering was that the interactions among the caregiver or the parent, the environment, and the child all go together, and they all have to do with one another. So, for example, on this next slide, you can see here that the caregiver, the environment, and the child all depend on each other, and they all have to do with the child developing in a healthy manner. So, for example, like the caregiver, they need to have good physical health, mental health, and in order to be giving their child a good childhood and their brain developing in a good way. And then the environment also is super important. So they all go together, and they all have to do with the child's mental and emotional and physical development. Some of the benefits of this theory are that through a successful parent-child interaction, behavioral issues as the child grows may be avoided. If the parent knows how to deal with the child's wants and needs and is there for them from a very young age, then the child will rely on their parent and they'll trust their parent, and behavioral issues can be avoided. Another benefit is that nurses are able to promote healthy environments and educate the new parents. A lot of new parents have no idea what they're doing, have no idea how to respond to some of the ways that their child's acting, or when they cry in their baby and it's hard to tell what they want because they can't speak. So nurses are able to help the parents learn what different cries could mean, like what time of the day could depend on if they're hungry or, if they need their diaper changed or if they just need some love. And so that kind of ties into the next benefit. The theory, alleviation of the child's distress. Being able to respond to the child when they are in distress is very important in their development and their emotional well-being. And so this is a great benefit to the theory that nurses are now able to teach parents and teach caregivers about how to deal with. Some of the limitations of the theory are there's very little information about the maintenance of a stable environment. So the nurse can kind of explain to the parents kind of what their environment needs to look like, how there needs to be not fighting between the parents, not like negativity. But there's very little information about how to maintain this stability. And so that can be hard on new parents who have no idea what they're doing or how to provide a stable environment. And then another limitation is the theory is population specific, but not according to disciplines, which can also impact early interactions if someone is not trained with infants. How the theory can be applied to the nursing care of patients. So, like I said earlier, Barnard founded the Nursing Child Assessment Satellite Training Project, which provides healthcare workers with guidelines for assessing infant development and parent-child interactions. And so these days, nurses can teach these parents how to deal with different situations with their child and how to interact with their child. And these healthcare workers can assess their development as they grow up to see if they are living in a healthy, stable environment and if their brain is developing correctly. Okay, so how I view this theory, I feel that this theory is extremely important to make sure the child develops in a healthy manner. Growing up in a stable, loving environment really does have a lot to do with the child's mental health, mental well-being, development. And so my eyes are kind of open to this theory and how important it truly is to have a stable household, a stable environment, stable parents. And I guess I just never really thought about how all of these coincide together and they all have to do with one another and they all rely on one another in order to make sure the child develops healthily. And so nurses are now very educated on how to teach parents how to interact with their child and how to respond to cues from the child. That's something I really never thought about as I'm growing up and I'm going to become a parent one day. It's very important how do you react to your child's needs and wants, and it's very important to start that from day one. And that's just something I never thought about. And so my eyes have really been open to this theory, and it's truly very important. And Barnard's research is something that is extremely important. And so, yeah, I really enjoyed learning about this theory, and it's really interesting to see like how these all interact with each other and how it truly does matter, like if having a stable environment and stable parents. And so here are my references, and so that's all for today. Thank y'all so much for listening.